In the heart of the capital city of Quito, Ecuador, the Eugenio Espejo Hospital is surrounded by gates and security measures to protect its patients and staff. Beyond its walls lies the harsh reality of economic struggle and despair. Marina and Angelo race to the hospital entrance with additional equipment, but are faced with 3 levels of security. They are eyed suspiciously by hospital police as their IDs are scanned. Fear and nervousness grip them as they wonder if they will be turned away. Will they be allowed to proceed, or will their mission be shattered?
They almost didn't let us in.
They never heard of us.
You okay? All right. Okay. So like this. That's the nerve. I'm pushing the nerve. Okay, tendon now. Okay, that's fine. So, but she is very sensitive here. Le duele aquí.
Sí, ahí.
Okay, esta lugar. Esta es secundario de problemas aquí, porque le da tensión. 这边这一个，不是上面那一个，上面这一个。During the examination of the heel, we found the pain is a very atypical location. And so Lee, our acupuncturist, think this is not an original problem. This is probably come from the upper part that don't get a good, it's not normal walking that's causing this. And then we examine, during the examination, we found out the knee. It has, for him, it's an equal part of pain. And the knee, he has trouble flexing the knee, both the range of motion and also the function and pain. And I continue to check along and find out he has a lot of hip limitation but because the range of motion of when we check the knee, we find out that he must have the hip was pulling on him. So we find out he has a lot of we also find out he has a lot of hip pain and low back pain. So that all explain the issue. So when we examine and we find out he actually have multiple different kinds of pain, but this is just the heel is just the new things that bother him, and the old pain which equivalent to the heel pain, and is less of his concern now, but the pain nonetheless is still the equivalent level of pain. So what the plan is, Lee gonna do a lot of acupuncture, take care of both from the low back, hip, and the knee, especially the tendon part. I prefer not to inject, and the heel, and hopefully teach him the exercise to can take care of this in the long run, much better way to deal with it. And I would rather not give him injection in the heel because that's a very sensitive area. And same thing, the tendon injection usually don't do very well, and unless it's very inflamed, this is very mild, so I prefer not to touch it. The only thing I might do is that knee. For my part, I think the injection will work better for him in the long run.
Acupuncture, a medical practice borrowed from ancient China, treats a variety of conditions by triggering specific points on the skin with needles. Low-cost treatments such as this are used to maximize the potential for healing in an area that lacks many critical medical resources.
So you have a triangle. You go here, go right in there. Toward the center of the knee, horizontally go inside. So that's all you need to do. So once again, I secure the location. You know this is the location. I'll remark that, so I pretty much imagine, because it moves. I imagine where it is in what level, and I do, there's no air, I'm ready. I look at that, I'm gonna inject. So I go in, I will shake a little bit. My hand kind of sorry, it's total. So I go in, I will know I'm already in the joint. Yeah, I feel that I'm in the joint. This much is already enough. Inject slowly and get the medicine into that. That's it. If you push and you get a lot of resistance, move back because you might touch the tendon, cause you to have a resistance, and you don't want to do that. You want to go very easy inject into the area, not inject into a tissue that you don't want. Yeah? Okay. ¿Se mueve bien? Okay. ¿Ya?
Ya no hay dolor.
Ya no hay dolor. Muy bien. Okay. Muchas gracias. Okay. Yeah.
No hay dolor.
Okay. Okay.
Yeah, normally when we have our mission trips pre-COVID, we have thousands and thousands of people that hear through the radio that we're coming. So this is what it's normally like. You go through all these thousands of people, and they come to you and they travel. Like this young lady, I guess, has traveled for the last 5-6 hours to get here, which is, if you had a car, it'd only be 2 hours, they said. So this is what we would normally do. Our surgeons would stay in the OR. We go through all the people and see the people that we could help that have the biggest need and that we could help within the amount of time that we're here. So it just so happened that we're gonna check out this young lady and hopefully get her some help today.
We are introduced to Blanca Marina, a woman who suffered a tragic accident that disfigured her face 7 years ago. Because of her low social standing, she did not receive the restorative surgery she needed. It's a heartbreaking reality that her young son has never seen his mother's true face. We are left to wonder if she will be approved by the hospital. Will the surgery she needs be possible? As we wait for answers, Blanca Marina's unwavering spirit is an inspiration to all.
Yeah, this is our bus driver. He's been Marco. Yeah, that's the brother. He's been helping us out while we've been here. Anytime we call him, he shows up. It doesn't matter what time it is, so he just so happened to tell us about his sister that needs a little bit of help. So this is usually what happens when we come out and we travel and do mission trips like this, is the last set of CT scans were actually when it happened, and these are 6 years old. So even if she tried to get any kind of medical care, she would have to go get a whole set of new CT scans that she would somehow have to pay for herself, and then try to find the physician or a surgeon that would operate for her. So it's like nearly impossible just to obtain a new set of CT scans. So normally this is what they do. They come to us with scans, but they're so old that there's nothing we can do with them. So hopefully today we'll get the new set and show them to Dr. Tyner and see if we can get this done.
We join Marina and her team as they strive towards a crucial first step, a CT scan. Jennifer is determined to make it happen today. We are reminded that collective effort and positivity can move mountains. As their mission unfolds, we are filled with a sense of promise and the palpable feeling of hope. The members of Team 2, led by medical prosthetic experts Robert Openshaw and Gloria Soto Reyes, are on the move to a new facility located just steps away from the hospital. Together, they have dedicated their lives to providing prosthetic care to those in need. Robert's tireless dedication to patients, along with his knack for reutilizing donated prosthetics, has changed many lives.
My name is Gloria Reyes, and I am a physical therapist. This is my 9th EMA Helps mission here in Ecuador. I work with the prosthetist, Robert Openshaw, and we work with amputees of lower legs. So we give above knee or below knee, and then we also work giving ankle foot orthosis for people that don't have function of their leg because of a stroke or a neurological deficit. I've always wanted to be a missionary in some capacity, but then I got married and life got in the way, and I just never revisited the idea. But it was always in my heart to give back. It was always a desire of mine to make the world a better place. And Ima has allowed me that opportunity of sharing my gifts, my talents, my language skills, a lot of things that Ima has allowed me to do. And I crave the company of the people that I have met because they are like heaven on earth. They are the nicest, most altruistic, giving people that you will ever meet.
Meet Patricio Aguilar, a fearless athlete, biker, and runner who suffered a devastating car accident. Although offered a prosthetic leg, he refused it as it didn't fit him properly. My name is Patricio Aguilar, and I have had my amputation for 2 years now. I lost my leg in a traffic accident when I was on a motorcycle. The doctors simply could not do anything with my leg. They had to amputate. They were the worst months of my life. And now, 2 years later, I feel happy to be able to receive a prosthesis and to be able to continue with my daily routines. I am forming a special project for people with physical disabilities. From now on, be it arm or leg or whatever, my objective is to motivate people with disabilities so they can participate in the sport of cycling, which I love.
Bring compared to what I usually do.
Done a lot of work for the city.
I don't do it like this usually.
Because of my Spanish
That silicone thing up against there, and it's sweat, and then it kind of macerates the incision.
Why you do what you do?
Because I enjoy it, and because we're helping people that would rather not ever get anything, and we've this is my 15th mission, and I really enjoy helping the people.
In the hustle and bustle of a chaotic emergency room, Jennifer Padilla has secured approval for Marina's much-needed CT scan. A daunting set of hurdles lies ahead, but for now, a flicker of hope shines bright for Jennifer. I was a passenger on a motorcycle and suffered an accident in 2013. They told me I was going to have surgery, but it's been years and I haven't received any. I was in a coma for 1 month with many facial lacerations. As the doctors review Marina's CT scan, the plates holding her deformed face together are seen. Her nose and one eye were lost in an accident, and the plates are a lasting reminder of the severe trauma she has suffered.
Oh, and I'll go there. Trust my word, I'll take the dare. From stone to stone, from heart to heart.